Hello, how are you? Welcome to another session on management of gender-based violence. My name is Winnie Barawa. If you're new, we are doing a series on GBV and we are comprehensively exploring the different aspects that pertains to it, from the basic concepts to the causes, myths and misconception. And in this lecture, we are going to look at the management of gender-based violence, and we shall focus on survivor-centered management or survivor-centered approach. But before going further, if you've not yet subscribed, please give this channel a subscribe or click on the subscribe area and click on the bell so that when I get another lecture, you can be the first to be notified. So in the first introduction bit is to first understand that in the management of GBV, there is no one case approach. It can take place in different methods, which I will briefly highlight here, and then we will go into details about the survivor-centered approach. So in the management of GBV, we can have direct service delivery method where we get the team or the involved team working closely to take care of the survivor, and could be either medical management, it could be nursing management, it could be psychological management. So this is basically service delivery approach. Then you can have case management where we can do one case at a time, and case management is really advised because this now brings a multi-approach way where you get to engage each and every involved team. So you can either have a case being managed under the legal team, you get to have the medical team, you get to have the social work team, and the case management is really comprehensive as opposed to direct service delivery. You can also have GBV specialized psychosocial support. This mostly looks at the mental aspect of the client, where we look at counseling, we look at psychological support, psychological management, and all that, or trauma counseling. So psychological support approaches more on the mental approach. Then the other bit is on clinical care, and clinical care is more on the medical advice and medical care, where we look at if in case of physical injuries, you can have wound care or nursing care. If it's case of disability and you need reconstruction, you can have reconstructive surgeries. Or in very severe cases where there's need for rehabilitation, we can get physiotherapy and more so. But there's also the legal support or the legal approach, where we talk about the the legal system coming in, and that is court approach, law and order, and so on. But there's also economic reintegration, which is really like a social approach. And in this case, you look at the economic losses that the victim could have lost or the survivor could have made. And in this regards, you now get to look at how do we economically reintegrate the survivor back to the community based on the economic losses they have made being a survivor of a gender-based violent issue. So in this video, we are going to focus more on a survivor-centered approach so that we see the different ways we can manage a client. And in this approach, we will summarize it first so that we look at the different guidelines we can use and the different ways you can handle a client. So looking at the case management of GBV, which I had mentioned prior, that this is one of the most broad way of handling a case of handling a GBV case. The survivor-centered approach encourages us that, number one, we need to uphold respect and dignity for the client by understanding that, yes, as much as we have a survivor client, we need to appreciate that they have their rights, and we should make sure that at any given instance, we uphold dignity and we uphold respect to their human rights and freedom. On the other side, we are told to avoid victim blaming attitude, where we practice approaches that either bring shame or fear to this client. So let's start with the first bit of where you need to uphold dignity and respect. So survivor-centered approach encourages us to uphold dignity and respect for the human rights and freedom by understanding that our client has a right to choose. The survivor has a right to privacy and confidentiality of the information. We also need to practice non-discrimination, that to it they should feel not discriminated while they're going through the management, and the client has a right to information, that is disclosure of any information that pertains to them, and that we should uphold safety. And the safety bit is about their physical safety, mental safety, and even social safety in regards to whatever that will be happening, or the management that will be offered to them. Well, on what we are advised not to practice as healthcare professionals is to avoid victim blaming attitude that can actually make a survivor feel powerless, or the survivor feel some form of shame and stigma. You should also avoid any attitude that can elicit discrimination on the basis of either gender, ethnicity, race, age, or any form of discrimination that can appear on the client. Then it's not good to have an attitude that can make the victim feel like they have no consent and they just have to do what they are being told to do. And the victim should also not feel like they're being cast out. So avoid any victim blaming. Although in the management also, I need us to understand the word victim is really, really avoided. So as much as it may be the social term that majority of people use, but the respectful term you're supposed to use in any management of GBV case is the survivor word. So I apologize for any time maybe where I'm using the word victim. It's just part of unlearning, but survivor is the required term that you should use in the management cases. So in the case management of GBV survivor-centered approach again, we are expected to uphold key principle, and one of these priority principles is maintaining safety, maintaining confidentiality, ensuring there is no discrimination, and ensuring respect for the survivor. We are also advised to allow that the survivor should be able to tell their stories, and hopefully the story should be told into a specialist. And a specialist here could be any person who has been trained in management of GBV cases, or could be any healthcare provider who has specialized in the area of gender-based violence. It could be a nurse, it could be a doctor, it could be a psychologist, a social worker whose main focus and specialization is management of GBV. We are also advised to uphold the principle of do no harm, that is, cause no harm to the client or cause no trauma to the patient. Then you need to ensure there's informed consent. Despite the survivor needing care, you need to seek consent for each and every step of management that you may engage the client. And the survivor also has a right to access specialized services. That if a client needs, for example, clinical services, then you need to at least ensure the person who is taking care of the survivor has a referral system to ensure the survivor gets to access these services. And this now brings us to this level where we talk about the referral pathway. So a referral pathway by definition is explaining that this is a flexible mechanism that safely links the survivor to the needed supportive and competent services. That we've mentioned, if a survivor needs certain services, then the one offering these services should be able to provide a proper referral pathway to ensure the GBV survivor can get taken care of comprehensively. So the flexible mechanism that safely links the survivors to the care and services that they need is what we are calling the referral pathway. They might differ from one country to another. However, there's a common pathway that we expect any caregiver can actually refer our clients to. So in other terms can also be the process by which different professional sectors communicate and work together in a safe, ethical, and confidential manner in a bid to provide survivor with comprehensive support. So it's advised that at any given time when you are taking care of a GBV survivor, then you should understand the processes by which the survivor can get in touch with a professional, they can get in touch with an institution or an office that can help them with further management pertaining to their case. So the referral pathway is advised to include several aspects, and in here we can talk about healthcare aspects. So that is now looking at the clinical management, looking at the medical, the nursing, psychological aspects, and all that. Then you can look at the psychosocial pathway where we have now coming in with social services or coming with psychological services that can help stabilize our client both mentally and socially. The other bit is security and protection. You need to remember that part of the types of violence is stemming all the way from harmful community practices, harmful traditional practices. Now, with this, you may understand that some could be at physical risk, that is physical injuries and violence, and so you need to provide security and protection for them. You need to know about the legal system and the legal justice system. And the other bit is provision of economic reintegration support. So the GBV referral pathway looks at different aspects and it needs to be comprehensive. And if you can do an interconnectedness in the essence of health, psychosocial, security, legal systems, and economic reintegration, then you can basically say there's comprehensive approach into management of the GBV cases. So here is an example of a referral pathway that I found more a bit helpful. So this guide is a general pathway and it stems from the stages when a survival case has been identified, and it guides us into the different essential services that a survivor can be guided from. So the beginning point is the survivor can reach out. So if there's a case of a survivor, the survivor can reach out themselves, or you can have a case of where a witness identifies a GBV case. So remember, most of the time survivors may not be willing to disclose their violence cases or their GBV experiences. And for this case, could be maybe a volunteer observes the case or witnesses the case and they can initiate the pathway. Or you may find a professional identifies the case and they pick it up from there. But in a case where the survivor reaches out, then the survivor can reach out into anyone they trust, and the trustee, in this case, the person whom the survivor has opened up to, can now refer this case into the related areas. So you are advised you can open up at any of these spaces, or you can begin from any of these spaces, where you can begin from the community, and that is now the survivor has consented and they can open up maybe to a community member. The survivor can also talk into a healthcare, it could be a nurse. The survivor can open up into a family member. They can open up into what we call the hotlines, where they can call and they can get help from there. Or they can talk into a police officer, they can talk into a legal system officer, or they can talk into a teacher. Any of these can be a trustee in this case. So if the survivor consented, then the survivor can accompany that person to the nearest health center where they can start opening the case. So the health center, then we can have initiation of the clinical services, and the nurse or the doctor can examine the survivor by doing the medical examination, initiating, for example, emergency contraception services, or the HIV and AIDS PEP, that is pro-exposure prophylaxis for treatment of HIV and AIDS. You can also now start tests for other aspects like sexually transmitted infections and treatments. And while this is ongoing, then the health center can refer this client to the different referrals. And that can now be initiation of psychosocial support. They can initiate now medical follow-up. You can initiate legal system through the protection and investigation services. They can refer to a lawyer who can help with justice in courts. And through this case management again, we can have referral to the psychosocial support system, that is how to reintegrate back into the community, how to live together with family members, and even how to go about with the education system. So the survivor needs to be willing first to consent that they need to be helped, and the person whom they open up to can help the survivor. Remember, the effects of gender-based violence, most of the time the survivor is not willing to open up. Not every survivor is willing to open up because the community has a stigma when it comes to GBV cases, and they might actually look down on the survivor, or they might water down the confidence of these survivors. And so we have to ensure that the survivor is protected, and that's why we're talking about the survivor-centered approach. You need to be compassionate enough to the survivor and encourage them to push through with the case. So just to rewind on it is, once the survivor opens up to any of these trusted sources or any of these trustees, then the trustees can help initiate the process. And advisably, you can initiate it from the health centers or the health facilities. And most health facilities have gender desks, or they have the gender departments or the GBV departments that can help with initiating the processes of doing the medical examination forms, initiating emergency care, looking at prophylaxis, looking at now test and lab investigations that later can be used as evidence in the court of law or in the justice systems. And while doing this case management, we now initiate the other referral systems, including psychosocial support, that is community areas, family, and even education system, or any activity that the survivor was engaged in. We can also look at it in form of now following up medically, because if you have initiated any form of clinical management, there will be need for follow-up. We will discuss further on the comprehensive management and guidelines pertaining to all these parts, like medical care, what exactly should happen, protection, what exactly should the police officer do, and so on. So we have the medical follow-up aspect, we will have the protection and investigation aspect, more so done by the police and protection officers. And then we have the legal aid and the legal system, where we talk about now the case being in the courts and talking about the legal system in terms of law and order. So this is an example of a summarized pathway that one can use. So this is an extrapolated again on the same thing. So whereby the referral system begins, and it starts by the survivor telling someone or seeking help. So the beginning point is reporting. So the survivor tells someone about the case, and the survivor trustee can help in the reporting. So in the reporting, there's the immediate aspect that you start from, and you're talking about starting from a medical health facility. And in the medical health facility, then we can begin the services of now doing the physical examination, engaging in the psychosocial support, and then from there we can refer to the other systems, that is the police. We can go now into the legal aspect, like with the legal assistant counselors and protection officers. Then this now follows up with the follow-up. So basically, to summarize this, we have the beginning point is reporting, okay? Then after reporting, you go to the immediate response, that is the medical health centers. Then from the medical health centers, then we shall go into the legal system, that is the police and the legal action. Then in the legal action, once that has been properly done, we do the final bits now, where we talk about the follow-ups and any other services that may be needed for our patient. So in summary, to comprehensively handle a GBV referral pathway is we need to implement healthcare, psychosocial services, protection, security, and justice actors, and then we need to put in place basic needs, that is now economic reintegration, looking at basic needs of the survivor, shelter, looking at children's services if you're looking about children, um, safe houses if the client needs to go into a safe center for further protection, if you're worried about their security and how they'll be able to be back in the community due to the status that they are in. So this is summarizing the pathway, that you begin from the reporting time, go for the immediate responses, after that is properly done, then you go for the legal action and then the follow-up. So the first step summarized here is report, immediate response, legal action, and then we focus now on the follow-up and other services. So I hope this helps someone who is wondering, if you have a GBV case, where do you start from? So if you have a GBV case, begin with the health center, let the client be examined, checked on, then the healthcare professional involved will fill the required form, and then this form will be referred into a health facility, into a legal system, that is the police, the lawyers, and then they can help with the justice and the court system. And then the other bit now will be doing follow-up management of each and every case that has been identified. And here is the pathway, what we call the referral, the GBV referral pathway, but we are focusing into the Kenyan system. So in this system, we are focusing more on the sexual violence. I want you to be clear on this so that you don't quote it on each and everything. There's different pathway for the violences, but the sexual violence being like the most common one, it has a pathway, and this pathway is referring to the Kenyan system. So what's the starting point? We said in summary, you have the reporting, the immediate response, we have the justice and legal action, and then we do the follow-ups. So this is the pathway for sexual violence, and we start here. So I will take some time to explain this. So to initiate the reporting, the patient will report to the outpatient department, where they'll first register the case. That is, there'll be registration of the survivor's details, and then the survivor will go through debriefing. Remember, you have to create a conducive environment where the survivor can talk and engage. So you'll have survivor debriefing, and then you do the triaging. So at triaging, you're able to take the vital signs, temperature, pressure, general assessment of the client, and then you initiate the next step. So in the next step is going to the consultation room, where now either the nurse could be the one at the consultation room, or you can have the doctor, you can have the clinicians or the physician or any healthcare worker that has been placed at that particular consultation desk. Now who will take further the case and seeking consent. Remember, consent is very key. That is part of the principles of survivor-centered approach. So have informed consent, you do history taking, you go now into the physical examination, focusing on the medical exam, then you do specimen collection, filling of the forms, that is now the P3 forms that will help with the evidence at the police state. Then we have the pre-HIV counseling and testing, then initiating the first dose of PEP. PEP in full is pre-exposure prophylaxis dose for HIV and AIDS. You initiate that, and you should be sure that your client has reported this case within 72 hours. You need to establish that. Then once this has been initiated well and you've taken samples and test, then you let the test go to the lab. So in the laboratory, you will send test for HIV, you will send further specimen for other analysis like urinalysis. Then ensure you have put in enough evidence for the samples that can be taken for case, and then initiate emergency contraceptions. That is for clients who have gone out through the sexual violence and there were case of rape or penetration. Then with the tests undergoing investigation in the lab, you can refer the client for counseling. So with the counseling, there are several aspects that you need to look at, and the clients or the survivor needs to be counseled on trauma counseling. You need to do HIV counseling and testing. You need to emphasize on adherence counseling, check on follow-up sessions booking so that the client can come back. Otherwise, you may cancel a client, and when they go back home, they never come back. Or if they go to the safe house, they can do absconding. So you need to go through follow-up sessions. Then do psychological support group. If maybe the client is in denial, they are anxious, they looking depressed, you need to refer them to psychosocial support groups where they can be able to share their feelings, understand from an aspect of people who've experienced the same and have become victorious out of it. Then talk about legal care and referral systems. So these are very key at the counseling level. Then after counseling procedures, then you can go to the pharmacy, and at the pharmacy, the patient can be dispensed now with HIV prevention drugs, that is the PEP. Even if the HIV is negative, you will still have to give PEP. It's part of prophylaxis. Then initiate emergency contraception pills or emergency contraception methods. Start medication for sexually transmitted infections. If the HIV case is positive, then the client can be started on comprehensive care, and that is now initiate the HIV care that is on antiretroviral therapy and psychosocial support. Remember this, now we are dealing with a double case here. We're dealing with a client who has effects of sexual violence, and you have a case of a client who is HIV positive. So if the HIV case is negative, you can refer the patient home and understand their return follow-up visits together. Or if the client is HIV positive, you are told don't discharge immediately. Take them through understanding of the comprehensive care clinic so that they can understand how to go about the HIV care, the antiretroviral management, and the psychosocial support. But if the client is HIV negative, talk to them about what next, because they may assume because they don't have further management, then they will just go home and never come back. So remember, for both of them, for both HIV negative and HIV positive patients or survivors, tell them about the return and the follow-up visit, that they need to come back for follow-up so that you can check on the further checkups, outcomes from the management, or the different drugs and treatment that they are under on. So this is the summary. Survivor comes to the healthcare facility, goes through consultation, and the history is done and examination taken. Then the examination and test are taken to the lab for investigations, which will be taken back to the consultant for final decisions. And then the patient is referred for counseling. Then this patient can be taken to the pharmacy for medication. And regardless of the positivity or negativity of the outcome, you need to give your patient follow-up dates so that they can come back for follow-up and further checkups until they finish the cycle and they can now be reintegrated back to the community. So like again, this is the pathway for Kenya. The pathway could be different for different countries. So I normally advise, if you want to understand the survivor management flow, try to refer to the guidelines that guide the different country or the country that you are in. However, if it is the same for your country, then you can just adapt this and initiate a case management for your client. So thank you again for staying with me to the end. If this is really open-minded to you, remember to give us a subscribe, share, comment, and also like the video if it was really helpful. Thank you and see you in our next lesson.